John Melnick, Senior Analyst at Lux Research, and I lead the health and wellness research here at Lux. And I'm at the Lux Executive Summit, joined by Tom Beauregard, Chief Innovation Officer and Executive Vice President at United Health Group. Tom, thank you so much for
Sure.
joining us. Tom, a good place to start is if you could talk about United Health Group as a whole, and then your role as Chief Innovation Officer.
Great, thanks, John. Yeah, United Health Group is, I view UHG as a broad health system, and really there are two components. United Healthcare as the larger insurer in the U.S. and commercial markets, Medicare, Medicaid, then we have a global practice and military and veterans. And then on the other side of the enterprise, we have Optum as a health service company, which includes provider groups, technology-enabled systems, disease management models. And really what's so powerful about United Health Group is the pairing of those assets in order to drive innovation. Mm-hmm. My role as Chief Innovation Officer is really kind of two-part. I lead a team that runs an R&D portfolio at the corporate level, mm-hmm. But then the second part of my role is really to connect R&D efforts and innovation efforts across the enterprise. So we haven't centralized innovation at UHG. There's subject matter expertise that's very, very different. And you wouldn't want to centralize, but really what we try to do at the UHG level is to make sure that projects that are connected, should be connected, are connected. And we work to kind of amplify the great work that's being done across the enterprise.
Mm-hmm. You know, when we talk about innovation, it's really tempting to start with technology. Right. But you know, for us, innovation starts with a problem, right? What's the thing you want to solve for, and choosing the right problems to solve for. You know, healthcare, as much as any industry, is complicated with all the different stakeholders and all of the different problems. Can you talk about your process for picking the problems and prioritizing the problems that you want to innovate around? Yeah,
and I'll just start by saying that's absolutely our orientation. Mm-hmm. So what we're not fixated on is developing an app or partnering with a customer or prospect or working with a sexy startup, but we are absolutely fixated on our sort of the core problems in healthcare, and there are several that we're focused on. They include things like extending access to care in different ways, and a lot of that is technology enabled, some of it isn't. We have group models that are proving to be tremendously effective. Another area is clearly cost, and that's really, really broad, but managing the expected future costs of specialty drugs as they come through the FDA pipeline is an area of focus for us. There's so much opportunity there, but there's also cost drivers that need to be understood. A third area is just variation in cost. It's you know, across the U.S. you see in specific markets up to 300% variation for services that are shoppable. So trying to narrow that variation, trying to get consumers to understand sort of their opportunity within that. So there are a lot of categories that we're fixated on, and I would say that's across the organization. That's one of the things that we have done, I think, quite effectively when we talk about our innovation model, is we've gotten all 225,000 employees sort of focused around those main problem spots and coming forward with you know, different kinds of solutions.
Mm-hmm. And when you identify a problem where technology plays a key role in it, there's a lot of assets you have internally, there's a lot of innovation going on externally. Mm-hmm. Can you talk about the management and the development of technology around those problems, both from an internal perspective and then as you look for partners to and their expertise?
Yeah, I mean, we have, and particularly within Optum really is very much a technology company, mm-hmm. So we have tremendous development assets within Optum, but we also understand that in a lot of areas we can't go it alone. Mm-hmm. So we frequently do partner with outside entities, and you know, very specific examples will be things like FDA approved devices. We're doing a lot of work in the digital health space, helping individuals with chronic conditions manage on a real-time basis. So a specific example I'll give you is children with asthma. Oftentimes wind up in the ER room, and the reason for that is because it's a hard disease to manage, and the monitoring is not frequent enough. So one of the R&D projects that we're working on right now is a model that includes a Bluetooth-enabled inhaler, and coupled with activity bands. And that Bluetooth-enabled inhaler is an FDA-approved device. And what we're doing is honestly just sort of on a day-to-day basis watching children in this study and doing outreach when we see the potential for an event.
You know, at the summit, as we were talking about before the discussion started, there's a very diverse group of industries here, right? From chemicals and materials, electronics and IT, food and beverage. I mean, it really spans the Innovation 1000. And a lot of them are interested in getting into healthcare. There's some really attractive parts of healthcare, high margin, sustainable businesses. There's a lot of challenges in getting into healthcare, regulatory approval cycles. Can you talk about, as you look externally and look to engage with companies like that, what they need to bring to the table to be an attractive partner for you?
Yeah, John, I always go back to it's an asset that we don't have, and that doesn't necessarily have to be, you know, a hard physical asset, but it could be a technology platform. It could be an FDA-approved device. It could be a different distribution model that isn't available to us. It could also be just the right sort of relationship with consumers that we're trying to reach. And to be, you know, quite specific, right now we're working with the March of Dimes on a group prenatal care program. And what better entity to deliver group prenatal care than the March of Dimes as a not-for-profit in the healthy baby space. But it's those kinds of sort of assets that we look for when we're trying to solve a problem, and we're very, very open to partnerships.
I see. Is there any advice you'd have for companies that aren't as familiar with the healthcare space that are looking to get into it, of how healthcare may be a little bit different, or things you'd look for a little bit differently than some of the less regulated or non-healthcare markets?
Yeah, I mean, you're saying it. It's terribly complicated, right? From a reimbursement perspective, I mean, reimbursement is always key. I guess the advice that I would give is, you know, solutions have to be evidence-based in order to attract reimbursement, and you have to deal with the, you know, the appropriate privacy concerns that exist in health. And frankly, you know, that's one of the things that, you know, that's one of the assets that we bring. We're very good and obviously understand sort of how to deal with both the reimbursement models, and in fact, we are a reimbursement model, and deal with the privacy issues when it comes to consumers. But those are probably from my perspective, the two biggest issues that companies have to wrestle with as they consider sort of entry into the healthcare space.
Right. Changing gears a little bit in the last couple minutes here, healthcare has been in the news lately.
Right.
You know, a lot of changes have gone on in healthcare, particularly in the U.S.
Right.
Over the last 5 to 10 years, a lot of uncertainty in the healthcare system with changing political winds. Can you talk about, with all of that uncertainty going on around healthcare, how you maintain innovation focus in those unsteady waters?
Yeah, I would say that the idea of reform, right, doesn't really change the fundamental problems that exist. So I would say it doesn't change our focus. When we think about how we try to drive lower costs, how we try to drive less variation in cost and quality, how we try to drive better access to care, or better management for people who have chronic conditions, all of that is consistent, independent of reform efforts. And so I would say that, you know, are the sort of the core problems that we focus on from an innovation perspective are not impacted by reform debates.
I see. Well, thank you so much again for joining us at the Lux Executive Summit this year. I hope you enjoy the
Thanks
rest
for having
of the
me.
event.
Thanks, John.